Hello there and happy Valentine's Day. It is Valentine's Day and I'm talking about what I love, which is the brain and all things neurologic. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist. I'm the owner and founder of re+active Therapy and Wellness. I'm based in the Los Angeles area, and yay, somebody else said happy Valentine's Day. I did think it was funny. I was like, wow, okay, this is what I'm doing on Valentine's Day, but this is what I do and this is what I love. Every week I share a couple of live videos to share what we've been reading, what we've been studying, courses we've been putting together. And this week is no different. I'm working on a lot of different educational pieces right now. One is a course for physical therapists that is coming up at Combined Sections meeting for the APTA. That is literally next week. We just wrapped it up with my great colleagues at Mass General Hospital. And it's all on functional neurologic disorders. It's a whole day course. So if you're a physical therapist, I hope you're going to that. It's going to be awesome. And part of that is talking about the neuroscience. And if you know me, you know I kind of go down these rabbit holes of the physiology of things, because I really believe that when we understand what's actually going on beneath the surface, we can treat that thing and get down to the actual real cause. And I believe this in all of neurology. So I love diving into neuroscience. And this particular article today that I wanted to share about, let me pull it up here. It was from last year, and actually I saw this was one of the most cited articles in the journal from last year. Autonomic, endocrine, and inflammation profiles in functional neurologic disorder, a systematic review and meta-analysis. And what is so cool, if you look at author number 2 there, Julie Maggio, is another Julie, another neuro-PT that I've been so fortunate to collaborate with. This is the Mass General Research Group. They put out so many great things, and there's so much to learn from them. So from their lab came this really great systematic review and meta-analysis. And so we're going to be talking about this in the course that I'm doing for CSM, but I'm also working on an autonomic course for patients, a free workshop on autonomic, because it's so important and I think it's really not well understood. So stay tuned. That's coming very soon. So I love the autonomic nervous system. I find it really fascinating. And so I'm excited to share about this study. Disclaimer for this study is that there's not huge life-changing results in it. One of the biggest things that they concluded in this study is that functional neurologic disorders are so vastly different from one another that it's hard to see a specific profile. So as I go through the results and what they did, I think that's something to think about. Now, I want to put this also into context into one of my favorite things, which is our pie chart. This is, we should trademark it. Maybe I was going to say this is like the trademark of re+active. This is how we conceptualize our practice clinically. This is how we teach it. But literally, when we meet people for a consult for our programs, and talk to them about their stories, their symptoms, their testing and things like that, we start to conceptualize this pie chart. What's happening with motor control, sensory, psychosocial, lifestyle, autonomic, physical limitations. And each piece of the pie kind of changes shape based on that person's story. Well, we didn't just make this pie chart up out of nowhere. It was based on the literature and our understanding of different disorders. And so this is the neuroscience summarized in functional neurologic disorders. And you can see autonomic is part of the issue. There are studies that show there might be a low heart rate variability. There might be impaired resting heart rate. And I'll talk about that in this study today. Some studies have shown increased cortisol or a hyperactive startle reflex. Actually, other studies have not shown that as well. But overall, increased sympathetic arousal in the nervous system has been found in some people with functional neurologic disorders. So we're going to kind of hone in on this one piece of the pie of the neuroscience of functional neurologic disorders. And let me share just one other thing. Let me come back to the title. This title really grabs me because as I've worked with many people, done consults with many people with functional neurologic disorders, one of the things that I hear over and over again is autonomic symptoms. I hear changes with especially in women with hormone changes. But I hear some of that. I hear onset with like an inflammatory event, like a cold or flu or an illness, some sort of inflammation, even, getting a vaccine. And so it just really, when I saw this, I was like, oh my gosh, tell me more, because I see this. And just yesterday, I was talking to a family. We've got a young girl working with our team who has FND, and she got a cold last week, and it just affects her system, her immune system, her nervous system so much more than other people. And what I would think, so we're going to go through the results of this systematic review, which aren't super conclusive, but what they do say is that for some individuals, this is a strong marker for them. And so I think that's one of the things that you kind of have to take home from large scale reviews and things, is sometimes the data doesn't really come together to give something conclusive for everybody. But there might be some pieces that you can think about in screening for each individual person, right? So I always think about the individual in front of me and how does this research apply? So let's go in. How exactly did they do this? So just wanted to show you this because I always think like, gosh, this is such a painstaking process. So I have the study right up here in front of me. So when doing the systematic review meta-analysis, they're combing through the literature looking for studies where they looked at these different markers. So inflammatory markers, hormonal markers, autonomic markers. And really by the end, the reason I wanted to put this out here is that you can see by the end at the very bottom there, they got to 66 different studies. And let's see, they had 2 results on biomarkers not available. One of them was discarded because it was non-inflammatory. There were 9 in a language other than English, 15 that were participants not diagnosed with FND, and so on. So they had to exclude all of those. So at the end, they had 66 studies. And these studies included both adults and children. And I think one of the most interesting things is that some of the stronger findings were in children. And it seems to be, and even the authors say this, is that potentially the autonomic piece is stronger in children. So let's start with that. So I'll stop sharing this one. And let's start with what they found with the autonomic markers. So let me get to this summary. They actually, by the way, so when we talk about autonomic nervous system, they were looking at several pieces. And one was heart rate, just resting heart rate. The second is heart rate variability, which is, personally, I love looking at the autonomic nervous system clinically and looking at resting heart rate and looking at heart rate variability as 2 big pieces. So they looked at heart rate during a task. They looked at tilt table studies. We know these are commonly done for things like POTS. And this is the summary. So as I mentioned, in pediatric, in kiddos with FND, it seems like they may have an elevated heart rate compared with age-matched controls. They also found that so that's for the heart rate. They also found differences in heart rate between functional seizures and epileptic seizures. So that is something too that might be more of a marker for people. Now, heart rate variability, this is one of my personal favorites because we can measure it. We use the Leaf. It's a portable EKG that you can just stick on the skin. And they found that across resting and task conditions, so looking at people both in task and at resting, again, in kids, they did have lower heart rate variability compared to healthy control. Now, the other thing, I think this is like too much detail to get into in a lot of detail, but if you're new to some of the autonomic measures as a healthcare provider, I highly recommend this study because they actually have a really nice little table that talks through what are some of the different things that heart rate variability is measuring. And they looked particularly at parasympathetic parameters of it's RMSSD, root mean square of the successive differences. So that's a mouthful, but that's one of the parameters. It's really an index of parasympathetic tone in the system, and it's a little less prone to the changes in the respiratory system. So that's something that's really important because some of the ways that we measure heart rate variability might not actually measure that. So important to take a look at. I know looking at Autonomic and measuring this was something new to me in the last few years. And I had to wade through all of this physiologic. I'm not a physiologist and I'm not a I haven't read a lot of that research. So it took me a while to wade through a lot of what this meant. So I recommend this article even just for looking at some of like, how do they measure this and how do they report it? So again, the heart rate variability seems to be lower in kids and trending lower as well in adults. It's not statistically significant. This is by far what we see when we're measuring it in people with functional neurologic disorders who are with us for their programs. We're absolutely seeing that there's low heart rate variability in some people. And maybe more importantly, that can change. So that's what's really neat about looking at this in detail with a client is that we can measure it, we can get a baseline, and then we can look at those activities that really improve heart rate variability. So they did look at other pieces. So remember I had mentioned startle response is an autonomic piece. They looked at skin conductance. And these are some of the findings that had mixed results, meaning not a clear statistically significant difference between healthy controls and people with FND. They did find that possibly skin conduction could be decreased in people with around their seizure time if they have functional seizures. But again, that wasn't statistically significant, but it was just a slight difference. So in those particular measures, which I don't do skin conductance measures, but in those particular measures, not as strong evidence yet. It doesn't mean that it's not the case for some patients. So how about the endocrine findings? So those were the autonomic findings. In summary, stronger findings in kiddos, higher resting heart rate, lower heart rate variability. Very interesting. Exactly what we see clinically. I love when what I'm thinking about clinically, but I don't get to test, shows up in the literature. So let's talk about endocrine findings. So here they're looking at cortisol. They're looking at it during tasks and at rest and before and during and after seizures. They look at adrenocorticotropic hormone levels. Those have been analyzed. And again, not significant differences. So they found that there are some individual differences. That's certainly interesting, and I've certainly seen that as well, but not really useful to actually be a marker of this is FND and this is not FND. And basically, they said that more studies need to be done in the hormonal realm. Okay, so that's endocrine. Let's talk about inflammatory. The first category that they had in the inflammatory was BDNF, one of my favorite neurochemicals. Could we all just be bathed in BDNF right now for Valentine's Day? I think that would be lovely. So BDNF, brain-derived neurotrophic factor. And they actually reported on 2 studies that found BDNF in the serum was decreased in FND compared to healthy controls. However, they were not different from other neurologic disorders. So it didn't really differentiate somebody with FND from somebody with depression, or somebody with FND from somebody with an epileptic seizure. So that might not be as helpful, but certainly makes me think, okay, well, if BDNF is low in any of those disorders, how can we drive it, right? And we know, for example, exercise drives BDNF levels in the brain. So I'm a big proponent of exercise. Now, we also know that when people have autonomic dysfunction, it can be hard to exercise. This is where this kind of physiologic piece starts to overlap, right? So we have to address those pieces together. So that is the only I shouldn't say the only. The other studies had mixed results. They looked at C-reactive protein, platelets, immunoglobulin A, immunoglobulin M, lymphocyte counts, with no huge differences between groups. So again, inconclusive. So the biggest take home from this particular systematic review, and again, this was last year, so it's getting really a lot of the most recent literature, is mixed. It is very strong towards autonomic, so heart rate variability differences, but it basically says, hey, we need more understanding in the endocrine world, in the inflammatory world. And I think that's absolutely correct. We see quite a few folks who have underlying inflammatory conditions, or just other conditions, EDS, POTS, mast cell activation syndrome, or MCAS. We see this with functional neurologic disorders. And so it would really make sense to me that there's maybe some overlapping mechanism that's going on there. And often the autonomic nervous system is a big piece that overlaps those systems, the immune system, inflammatory responses, and so on. So this is why I love the autonomic nervous system. And this is why I love diving deep into this. So again, the study was called Autonomic, Endocrine, and Inflammation Profiles in Functional Neurologic Disorder, a Systematic Review and Meta-Analysis. I'll put a link in our newsletter. I do that every week. So on Fridays, I send out a newsletter to my fellow healthcare providers. You can join that at reactiveeducation.com. And on every Monday, although today is when I sent it, it was a Tuesday newsletter day. If you're a person with a neurologic disorder or family member, I send that out every Monday, and you can join that newsletter at reactivept.com. And I'll send out links to the articles, I'll send out videos, I'll send out every resource that we have. We've been sharing one of our resources a lot this week, and really trying to get the word out about FND. And that resource is the 10 things to avoid in functional neurologic disorders, based again on the literature that shows what's helpful in functional neurologic disorders. So we know certain things that we do in therapy can actually make it worse. So again, you can get that handout also. It's a great little guide at reactiveeducation.com. So lots of resources. Thank you so much for your care, your curiosity, your advocacy for people with disorders that are often misunderstood. I appreciate you so much. I'm sending lots of love today for Valentine's Day, because I just love our community so much. So thanks a lot and have a great evening.